PE can happen to anyone, but the risk is high in certain situations. Prolonged immobility, car rides, flights, hospital stays, recent surgery or trauma. Patients with cancer are at the higher risk. Hormone therapy or birth control pills. Pregnancy is another hormonal state that increases the risk of PE. Obesity, smoking, and clotting disorders. Some are inherited and some unknown. So how is PE diagnosed? As always, we start with history and physical, but PE is tricky. It mimics so many other conditions. Tests for PE include D-dimer blood test, where elevated D-dimer levels can indicate a clot, CT pulmonary angiogram, that is actually the gold standard to see clots in the lungs. Also, an ultrasound of the legs looking for DVT helps. When it comes to PE, time matters. Diagnosing PE early can mean the difference between life and death. So now let's move to the treatment. For years, treatment meant hospitalization, IV blood thinners, otherwise called anticoagulants, and close monitoring. And the main goal of the blood thinner is to prevent the clot from propagating further and to absorb the clot. In the past, the hospitalization was relatively long because the mainstream treatment was anticoagulation with intravenous blood thinners. The main oral medication at that time was warfarin or Coumadin, and it took some time to build up its level before the patient could go home. Then it changed with the invention of low molecular weight heparin, such as enoxaparin or Lovenox, that patient could inject themselves, and that led to the decrease of hospitalization. Then more efficient oral blood thinners were introduced to the market, and that brings us to the latest research. A 2022 study published in a Journal of General Internal Medicine followed 652 patients with confirmed PE who were seen in primary care, not the emergency room. The results were interesting. They found very low rates of hospitalization within 7 days, very few serious complications within 30 days, safe, effective care at home. And this aligns with the new American Society of Hematology guidelines, suggesting that home treatment is safe and preferred for low-risk patients, especially when direct oral anticoagulants are used. But here's the catch. You have to be sure that the patient is truly low risk.